teeth.
Okay.
We place 4 implants. You have 4 implants on top, 4 implants on the lower.
Okay.
Make sure your bone is nice and smooth. Okay. So the only thing you'll see tomorrow when you leave are just these little abutments.
Okay.
Sitting right above the gum line.
Okay.
Okay. All your gum tissue will be sutured closed, so you don't have to worry about open sockets or dry sockets.
Okay.
Okay. Your bridge will be delivered the next day. We do not numb for that.
Okay.
You will feel pressure initially when it's seated. It just seats right on top of those housings.
Okay.
You have 4 little access holes where the screws go to retain the bridge, so it's not removable. It's going to be screw retained in your mouth.
Perfect.
So you can't take it out like a flipper or denture or anything like
Okay.
that. Once the bite is checked and the doctor checks everything, we'll fill those in for you so you don't see or feel them.
Okay.
Okay. You have 2 options of material. First one is our PMMA, which is our polymonomer acrylic.
Can I feel that?
Yep, with a titanium bar. And this is a nano ceramic.
I think I'm going to do the PMMA to start.
Perfect. It's a good choice. I don't think, do you grind your teeth?
I don't know. I haven't lately because they'll break if I do, but I don't
see
know.
a lot of wear on your teeth. Yeah, your molars are pretty good. No chips on the crown. I think you'll be okay.
Okay.
But we do offer, I always recommend to every patient, even if they don't grind, a night guard.
Okay.
It's a one-time fee of $500. We replace it if something happens to it when you come in. I always like to recommend this because it's a good cushion. It's not going to hurt anything if you wear it.
Okay.
Because sometimes the body's stress reaction, because it's different than what you're used to in your mouth, is to kind of clench or grind at night.
Yes.
You don't really know about it.
Okay.
Okay. So I always like to recommend one. You don't have to do it if you don't want to.
Okay. I'll do that.
So you just wear it at night, kind of like a retainer. It's a little bit thicker than a retainer would be. And then you just pop it out in the morning, brush it, and it goes on your lower bridge, not your upper.
Okay.
Okay?
That's unique.
Yeah.
Okay.
Yeah.
Perfect.
Goes on your lower. And then cleaning, you will brush right away. Not a regular toothbrush, but we'll use this. Pretend it's a regular.
Okay.
So you're not just going to brush the tooth surface. You're going to brush the entire bridge.
Okay.
The gum included.
Okay.
The first week to 10 days, you're going to be gentle along your gum line while it's healing.
Okay.
So this margin where your gum line meets the bridge gum line, you want to keep this nice and clean.
Okay.
But for the first week or so, just kind of gently brush the bridge.
Okay.
2 to 3 times a day.
Okay.
And then after, a week, once the sutures start to fall out, you can start to very gently just brush along that margin. Keep it clean because plaque can build up there. Okay. And then the second most important thing that you're going to do is water floss.
Okay.
Okay. Yeah.
Yes, I bought one of these.
We like the ones with the knob because you can customize it more.
Okay.
Travel is great for travel, but it only has a high, medium, low, so it's kind of better when you're healed.
Okay.
So this way you can start on like level 1 or 2 on a low pressure. Think of it kind of like a pressure washer. You don't want to crank it to 10 and make yourself sore.
Yeah.
Okay. So you start on 1 or 2 and you'll slowly work your way up to a comfortable level. Once you get to about 6 or 7, you don't really need to go past there.
Okay.
Okay, it's the same pressure around 10, especially on the newer models.
Okay.
You will have, the newer models come with the candy cane hook.
Okay.
And then it also comes with the regular hook.
Okay.
Okay. So you can interchange in between for different areas of your mouth, which works best for you.
Okay.
And you're going to gently flush where your gum line meets the bridge gum line.
Okay.
So flush underneath. And as you heal and the swelling goes down, you may notice some gapping. You may notice that you can see the metal connections. That's all normal.
Okay.
That's just the tissue healing.
Okay.
And then we fill in the gaps if they're too large at 6 months.
Okay.
Okay. So you're going to flush the whole way around 3 to 4 times a day.
Okay.
Preferably after each meal and before bed.
Okay.
Same thing on the inside. You're going to go on the inside on the roof of your mouth and go the whole way around. You're going to flush both directions.
Okay.
And then on the lower, we're going to pretend this is the bottom now. Right here in the front where your tongue hangs out all day, right here in the front, is where people build the most tartar. You have your salivary glands in the front there under your tongue. So make sure that when you're brushing, you can feel your bristles on your gums.
Okay.
And you feel the water flosser on the gums as well to
Okay.
flush underneath.
Okay.
Okay?
Okay.
And you're just going to go the whole way around. Okay?
Okay.
So,
And this is for the lifetime of the... Perfect.
Yep. The flossing with the thread floss takes patience. Okay? Think of it like a little needle and thread. As long as you're water picking properly and brushing properly, it typically takes care of any debris that can be underneath the bridge. But if you are able to floss, you're gonna close halfway. Don't open the full way because your lips will get a little too tight and taut. So close halfway, and you'll gently pull your lip up, and you'll kind of just poke around until you find a sweet spot to go through. You'll thread it through, pull it out from the back side of the bridge, and then you're going to go back and forth, back and forth.
Okay.
So you hit that implant, then you're going to shimmy that implant like you shimmy your back when you dry out, and then you'll pull it through, and then you just do the same thing the whole way around until you find another kind of sweet spot. You'll thread it through, and you'll go back and forth, shimmy that implant, and then pull it through, and then the back of the bridges are pretty easy to get under because you just loop it underneath.
Okay.
Okay?
Sounds good.
Yeah. That's it. Yeah.
Questions, Kristen?
No questions yet.
Okay.
I'm going to take